name is Ashley Palmer. I'm a Senior Research Scientist at NORC. I'm a researcher and policy analyst focused on improving healthcare delivery in the Medicaid program. My work is devoted to driving whole person care among state Medicaid programs. Whole person care is an approach to health service delivery that ensures people receive comprehensive care for all their needs. For example, imagine a child who frequently gets asthma attacks because of mold in their home. In a system that practices whole person care, when the child goes to a healthcare provider's office, the provider not only treats the asthma, but also helps the family address the mold issue. Whole person care addresses individual, family, community, and population-level drivers of health. It's about creating value in the healthcare system and promoting wellness and equity for everyone. Medicaid has been on the forefront of that innovation, experimenting with new ways to ensure well-being. For example, California Medicaid currently has a whole person care pilot program designed to improve the coordination of health, behavioral health, and social services. Developing a whole person care delivery system has its share of challenges. A major challenge for Medicaid is that behavioral health care has traditionally been siloed from physical health care. There are also challenges associated with using a healthcare system that traditionally offers physical healthcare services to address things like housing or social support that fall outside of their usual scope of care. State Medicaid agencies have multiple levers that they can use to improve their delivery system and offer whole person care. A framework created by NORC describes these levers, and state Medicaid agencies can make progress toward whole person care by pursuing any of them. For example, agencies can encourage individual providers to use evidence-based tools and models, such as screening, brief intervention, and referral to treatment, otherwise known as SBIRT, to integrate physical and mental health care services. They can also use established methods like payment, measurement, and oversight to promote collaboration between new partners and enhance case management. However, to really transform the system, state agencies and payers have to work together. That means aligning stakeholder efforts, promoting information exchange, and identifying gaps in the system. A good example of why whole person care is important is Medicaid's early and periodic screening, diagnosis, and treatment, or EPSDT benefit. It's designed to make sure that children on Medicaid have access to all the services that they need. EPSDT aims to discover and treat childhood health conditions before they become serious or disabling. However, a 2019 GAO report found that many Medicaid-covered children do not receive recommended screenings or services. To improve the situation, the Center for Medicaid and Medicare Services recently issued strategies for states and managed care plans to ensure that children are receiving all of the services that they need to promote their development and their future health. Suggestions include participation in innovative delivery system models meant to improve whole person care. These models include patient-centered medical homes, integrated care models, collaborative care models, and health homes. Whole person care is critical to ensuring the health and well-being of our nation.